Hello and welcome to our special call-in show on coronavirus, where we answer all your questions, any queries, any doubts you may have regarding the disease. And today we're also going to talk about the testing. Remember, there's been a bit of a controversy over the rapid testing kit, so we're going to focus a bit on that. Joining us to answer all your questions, we have Dr. Shanmugasundar Gopal, endocrinologist, joining us from Chennai, and Dr. Muhamed, Shaloob, interventional cardiologist from Calicut in Kerala. Thank you so much, doctors, for joining us this morning and sparing your time to take all the questions. And in fact, we already have some questions lined up. We have a caller from Jammu, Ajay, calling in. Go ahead with your question, Ajay.
Yeah, hello, can I call? Can I talk?
Yes, please go ahead.
My question is that because of the stress we are undergoing because of lockdown, I have come across a patient whose tachycardia is not controlled. Tachycardia, preferably in the morning hours of the night. The tachycardia is not controlled, it goes up, and because of that he has sleepless nights and he is disturbed. Why is it so? Is it because of diet? Is it because of stress? Or is it because of lack of medications or lack of health care?
All right, Ajay, thank you for your question. I think this is a very, very common concern during this time. Dr. Shaloob, to you first. He's talking about how he's not able to sleep and he's having all these concerns and cardiac issues.
Hi, Ajay. See, the thing is that, tachycardia is something which can be normal also. It can be a sinus tachycardia. It can be because of anxiety and the things going around us. So we have to worry only if the tachycardia is abnormal, If as I know you're worried about the COVID thing. So the thing is that, in COVID, only if you have symptoms of COVID, or some patients can have without symptoms of COVID, arrhythmias in around 10% of the cases, and it's usually atrial fibrillation. So if you are worried, you can just consult some doctor nearby, take a ECG and see if it's a normal sinus tachycardia. If it's a normal setting, we can give some medication to control the heart rate. So there's nothing much to worry.
All right, Dr. Gopal, also this complaint about not being able to sleep, this is something we're seeing a lot, and a lot of elderly people are already under a lot of medication to manage various other conditions, and now a lot of them are depending on sleeping pills as well.
See, again, it's a very important question, and Dr. Shaloob has addressed it related to the COVID-19. But again, this stress, what we are undergoing, because it's an extraordinary situation, no one has faced it. So everyone is under the stress, particularly the diabetic people or hypertensive people who are on a lot of medications. They are not able to see the doctors. So definitely there may be some changes. So important thing is we are going through a tough phase. Probably next 1 or 2 months we are going to face it. After that we are going to come out of it. So it needs reassurance from their own doctors and the family members. And government is doing its bit to educate all the people. So they have to take healthy food and they have to maintain their physical activity, which is very, very important, because now due to the changes, they may not be going out to the regular jogging and all, but at least they should do some floor exercise, or say they should go for walking in the terrace. So they should maintain their physical activity and they should take healthy foods, which gives zinc or magnesium, so that they stay calm. So it's very, very important issue. Post-lockdown, we are going to see much more cases due to the stress, but again, reassurance is very, very important thing.
All right. In fact, we have a related question. Ravi from Chennai. Go ahead with your question, Ravi.
Hey, good morning, everyone. My question is about, doing pranayama or the breathing exercise. And I was looking at NDTV a couple of weeks ago. There was a suggestion that not to do inhaling because it can be prone to infection. Wanted to know whether pranayama can be done. And very quickly, if I can ask a second part, can we take uncooked food like salads or vegetables? There is another theory that once it goes into the stomach, the acids will kill the virus. Thank you.
All right, Dr. Gopal.
See, again, pranayama, definitely it can be practiced, unless if you are in the environment where there is already COVID-19 positive and there is a chance of high risk of aerosol transmission, which is very, very rare. It's particularly documented in the hospital setting. Unless it's there, I think it's better to practice breathing exercise so that it can improve your immunity. And if you get infection also, it helps you to fight against the virus. So I don't think so there is any contraindication to do the pranayama. We advise to do it. Even the government is giving advice to do it. So always you can go for it. And second part, coming to the vegetables and fruits, again, there is a lot of confusion regarding this. So we can't wash the fruits and vegetables with the soap and water. So it's always better wash your hand with the soap and water before cooking the vegetables or eating the fruits, and wash the vegetables and fruits which routinely we do with running water, and then use for cooking. And raw vegetables, it's very difficult to say. What the WHO is advising is use partially cooked vegetables so that you can retain the nutrition. That in that way it can be safe to take.
All right, we have another caller from the Andamans, Prem Kamata. Go ahead with your question.
Hi, I'm calling from Andaman and Nicobar Islands. I actually have a question.
Yes, go ahead.
I have a question, sir, that I'm actually in institutional quarantine.
Yes?
I actually have a very narrow corridor, and we use the same corridor for taking. So what I want to know is that whether I don't know whether they are positive or negative, the neighbors. So when they are taking the food and they're sharing the same corridor, can it stay in the air in the corridor, because there is no ventilation in the corridor?
All right, Prem Kumar. I hope you come out fine from this isolation. So, Dr. Shaloob, he's very concerned about the fact that he shares this narrow corridor with his neighbors in this quarantine center, and when they have to take food, and of course the fears about whether the virus is airborne. What would you recommend he do?
See, the general recommendation is that it can stay when you cough 1 to 3 feet, it can travel. So we'll have to, if you're in a closed environment like what he says, Mr. Ravi says, and if you have to keep your personal hygiene. You have to cover your face with your mask. You have to wash your hands, and I'm sure the housekeeping people who are there, they are constantly cleaning the doors or handles and the wall, so that that there is no transmission. So this is what we can do. Of course, there is concern, and it will be good to be careful.
Yes, and ensure that your neighbors also are wearing the face mask when they come out. But wishing Mr. Prem Kumar all the best there. We have Ijaz calling from Srinagar. Go ahead with your question.
Yeah, good morning to all. We have been hearing about this plasma therapy. So, do we have data to believe that to support that it's effective, it's a breakthrough, or we can just rely on this?
All right. Well, I believe it's very preliminary right now, but yes, Dr. Gopal, why don't you take that question?
Coming to treatment for COVID-19, we don't have any proven therapy so far, and this plasma therapy has been used in quite a good number of patients in US and Europe. Still, we don't have the outcome data. It is not a published data, but they are claiming that there is some improvement in the outcome. Even in India, we have one patient recently from Delhi where there is improvement in the clinical picture, but we still don't know whether it's due to the plasma therapy or it's natural recovery from the virus. So we need to wait and see. Still, we have scientific data, because in medicine, everything is evidence-based. So we need to have strong evidences. Other than this, some drugs are on trial. Hopefully, within 1 or 2 months, we will know whether there is some good outcome with those medications. If there is a good outcome, then hopefully we'll have some medication for COVID-19.
All right, and human testing of the vaccine is also starting in some parts. So hopefully, some good news coming on that front. I wanted to ask you, in fact, doctors, about the testing, because we've had this big setback with these rapid test kits in Rajasthan. They've sent them back. They found issues with them. And the method that we usually use is RT-PCR, though rapid testing was going to be this big game changer in the sense, because, we talk about how we're not testing enough. So first to you, Dr. Shaloob, what would you say about the two, if you could explain to us regarding these testing methods?
See, now we have 2 testing methods. One is the RT-PCR, where we will, it usually positive when the patient is in the active phase in the first 1 to 7 days. And now the rapid test is about the antibody test, which is more, or the antigen protein, with more the antibody with the blood serum, what we are doing. Now the thing is that, the confusion is with whether it is faulty, the one which have been imported. But we have to study in our population. That's why ICMR has rightly told that, we'll wait for 2 days, we'll check it properly. So it usually gets positive after 7 days, antibody. The earlier question about this plasma therapy, I'd like just add
yes, why
it is little promising. See, there was a small study in China which involved 5 patients. The patients, with COVID 2019, what happens is, when the infection is severe because of the viral load, it can affect your lung, resulting in ARDS, requiring ventilation, and also it can affect your circulation, requiring supports to increase the BP. So in 5 patients between January end and March 25, they gave this for patients who are on ventilation for more than 10 days with recurring supports and high viral load, who are not effective with antiviral medication. As of March 25th, they could discharge 3 patients and 2 patients become stable. So that's why it is very promising. And this plasma therapy, now the government is going to do a big trial in our country. So this antibody test.
Yes, in fact, we have a question on testing, and yes, the plasma therapy, as both doctors said, it's in the preliminary stage, it's promising, but we're still waiting for more proof on that front. We have a caller, Surya Prakash, calling in from Hyderabad. Go ahead with your question.
Yeah, good morning, doctor. This is Surya Prakash from Hyderabad. Morning. Doctor, our testing has been quite low as it is, and now we are facing with the problem of defective testing kits, and due to which we don't know the results. And when do you think in India we will reach the peak, and when this band will be over? Like, when we reach the peak, it will be over, or when do you think the peak will be over?
All right, that's quite a deep question regarding the peak, but yes, this similar question to mine regarding the testing. Dr. Gopal, first you, a lot of worry over this front, the fact that rapid testing kits are turning out to be defective and we're not testing enough.
See, again, the gold, as Dr. Shaloob told, the gold standard testing is RT-PCR. So the conformity test is RT-PCR. So most of the countries, they are making diagnosis based on RT-PCR. So antibody testing is basically to see whether the person has developed antibodies to the virus or not. So it is helpful in the community setting, mainly in the hotspot, to see whether there is a community spread or not. So definitely there is a setback, and ICMR has also given in notice regarding that yesterday. So they are advised to do the RT-PCR test at present, which is a gold standard, and they will come back with the report on the rapid antibody testing. Anyway, we have to accept it, and we have to move forward, and we have to see what the government is doing for that, the next step. So coming to the peak,
yes,
hopefully we think this is the peak, and let's pray that it doesn't progress us. But saying that, in other countries we are seeing that it's gradually progressing, but relatively in India it's relatively slow compared to the Western countries like US or Europe, and possibly due to multiple factors like BCG vaccination or our innate immunity and the temperature pattern, etc. So probably the researchers or epidemiologists are suspecting that we will reach peak in middle or May end, and if lockdown persists, or if at least some strict regulations are persisting for more till May end or June, maybe we may become COVID-19 free by August or September. But again, all these are predictions. We don't know about the nature of the virus, because this virus is behaving differently in different countries. So we need to wait and see.
All right. In fact, the WHO has said it's going to be with us for a long, long time. But yes, how how it affects Indians is a thing that needs to be looked at. And Dr. Shaloob, if you could just add to that about the fact that we're not testing enough, then we don't really know what the numbers are. If we admit that we're not testing enough, then we don't really know what the numbers really are out there. So whether we're peaking, what stage we're at. A lot of patients are asymptomatic, and also at the same time, all this talk, a lot of doctors are flummoxed by the fact that it's not spreading as rapidly as we would have thought, or we're not seeing as many people in hospitals or dying of the disease, God forbid, and whether there's some sort of immunity Indians have. There's loose talk about it. There are doctors also talking about it, but saying it's all very preliminary right now. The BCG vaccine being talked about. So various issues when it comes to India.
Yes, true. You see, we have to understand we are a developing country, and we have to understand that our population is huge compared to all these Western countries and things like that. So the thing is that we have to judiciously use whatever kits we have and whatever. One good thing what has happened is, government has put this lockdown in, and the people have supported. It's a great thing. We can reduce the speed at which it spreads, and we can use our resources in a better way. That's what the best point is. So now coming to the antibody test, our gentleman asked, actually the government is going to do much more tests. It will be much useful in a state like where I am. See, because we have contained the disease to a certain extent. Now we want to know how much is it in the community. So this antibody test usually becomes positive after 1 week. But there are some problems. See, now reports have come from China that there is reinfection. Now there is reports coming from South Korea. 111 positive patients have become again positive. The Korean CDC told that it is because of reactivation of disease. You never know. Then there is a talk that the virus can mutate, which and a new infection come. That also is not very clear. We don't know as of now. So the thing is that and the method of testing in South Korea, for instance, they test within 24 hours and a patient in isolation and they get discharged. So maybe you have not got the virus, the antibody in that time, or
right.
It could be any. So these have implication for vaccine also. See, for example, this vaccine, if the immunity goes away after some time, then you will need multiple vaccine shots. Or if it is mutating, the vaccine which we have developed may not be effective. So yes, we have to do more tests. Like for example, now Goa has no cases, but they would like to know whether there is anything in the community, whether people have got how much percentage of patients without symptoms had this. So if you do more tests there, they can control it better in Goa, in Kerala.
All right. So a lot of more studies is needed, and this fear of it mutating is also something very real. We have callers waiting. We have VV Patnaik calling in from Hyderabad. Go ahead with your question. All right, we can go now to Hassan, who is calling in from Kasargod. Go ahead with your question, Hassan.
Yeah, good morning. Hello.
Good morning. Yes, go ahead.
Good morning, everybody. Hello.
Yes, go ahead with your question.
Yeah, good morning. My question is regarding the mask. The health organizers saying use the N95 mask, but nowadays they are saying that make your own mask and wear it. How? Because my doubt is on that. We don't know all the cases in India. That's interesting. So we don't know who having the virus, and also if you work in the ordinary mask, how it works on that.
All right, Dr. Gopal, if you could take that question. And this issue of masks is something that has changed from the start of this coronavirus, when doctors would tell us, everybody doesn't need to wear masks, to now when we're asking everyone to wear even cloth masks. And this is to do with the fact that people could be asymptomatic and still be spreading the disease.
Yeah, exactly. Because as we are discussing, we are still not very clear about this virus, how this virus behaves, and even now data are from US that many people are developing clotting in the blood vessels. So it's new data is coming out. So each day we are seeing new data. So again, recommendations are also changing day to day. So regarding the mask, now the recommendation is the healthcare workers or the people who are taking care of COVID-19 patients or near to the COVID-19 patients, they are advised to wear the N95 mask. Otherwise, the normal persons who are not near to the COVID-19 patient, or not in the hotspot, or not healthcare workers, the ordinary surgical mask or even the cloth mask will do, because we know that we have limited resource worldwide, not only in India, worldwide there is a limited resource. So we have to preserve this N95 masks for the healthcare workers or the people who are taking care of COVID-19 patients. That's why the WHO and Indian government has come with recommendation that N95 should be used only for those particular set of peoples, and cloth mask will do for the other normal people. As you rightly said, it is mainly to prevent the infection from the asymptomatic people.
All right, we have another caller, Bhaskar, calling from Vizag. Go ahead with your question.
Good morning. I just wanted to know, does cellular nutrition helps us to build a better immunity system at this hour?
All right, Dr. Shaloob, if you could first take that question. And there's a lot of talk of building immunity. I know a lot of people are popping vitamin C and doing all sorts of treatment to help build immunity during this time, which we usually do to ward off viruses and coughs and colds.
See, the thing is that the severity of the disease is related to the age. If you are older age, you can have if patients have cardiovascular comorbidities, you have more severe infection. And even if your immunity is low, so you can have a severe disease. So see, there is no clear trials which prove that taking all these things will improve your chances in facing COVID-19, but generally having a better immunity will be good. So in people who are fragile or who are not having proper minerals, taking these may not be a bad idea. But there is no particular trial which shows that taking this will go and help things.
All right, we have time for just one last caller. Pankaj calling from Mumbai. Go ahead with your question.
Yeah, good morning. Is it safe to have sex during these times? And when will the media stop using the word social distancing and use physical distancing? Because social
distancing is a word that was given to us by WHO, but yes, now there's talk of calling it physical distancing. But Dr. Gopal, first to you, should you maintain physical distance in the bedroom?
I don't think so. Unless your partner is positive, there is no point in physical distancing. So only the social distancing, that too particularly because we don't know who is infected. Nowadays, we are told that each and every person we should think as they are COVID-19 positive. That's why social distancing is advised. So otherwise, if at your home, if there is no COVID-19 positive cases, there is no need for any distancing, because with your wives or kids, there is no need for any physical distancing. Obviously, outside the house, because we are not sure who is positive or who are negative, so it's better to maintain the social distancing.
All right, anything you'd like to add to that, Dr. Shaloob?
No, what Dr. Gopal has already told everything. Actually, baby booming is expected, with this lockdown.
All right. Well, on that note, it's time for me to end this show. Thank you, doctors, for joining us and taking all those variety of questions that we got during the show. And thank you all for watching at home. Time for a break. We'll return with more.